All right, we're going to be talking about drugs that help prevent heart failure for the most part. But before we get to that, we'll just roughly go over some quick physiology dealing with the cardiac circulatory system. So, here's your heart. Blood enters this right atrium from the inferior superior vena cava, also from the cardiac sinus here in the back. Goes past the tricuspid valve, out the right ventricle into, so through this semilunar valve, and then that gets into your pulmonary arteries, which go to your lungs, come back via the pulmonary veins into the left atrium, through the bicuspid valve, into the left ventricle, out the aorta through the aortic semilunars, and then from the aorta you have your coronary arteries coming off on either side, and then brachiocephalic, left carotid, left subclavian, and then to the rest of the body. Comes back in through the vena cavas, right? Hopefully you know that pretty well by now. The electrical activity of the heart starts right up here at the sinoatrial node. Sinoatrial, because it's in the atria, right? And this is the thing that randomly depolarizes. We're not going to get into all the different reasons like how it depolarizes. It just has this autorhythmicity, so it beats by itself. It doesn't have to have direct nerve stimulation to control it, to tell it to beat each time. Instead, it's autorhythmic, it beats itself from the sinoatrial node and also from the atrioventricular node. You have things like these slow sodium channels and funny currents and all kinds of cool stuff. From the sinoatrial node, that depolarization continues down and across to the other atria, right? And it also comes to the atrioventricular node, where it kind of slows down this beat. So there's this interventricular septum, there's an atrial septum, that stops this electrical activity from just going through the entire heart at once. If it did that, then your atria and your ventricles would contract at the same time, and you wouldn't get complete filling of the ventricles that then pump it. And so this AV node slows that down, so the atria fully contract to fill the ventricles, and then the ventricles contract to send the blood to the lungs and to the rest of the body, okay? Your AV node sends the signal down these Purkinje fibers and then comes out. So you have your atrioventricular bundle, sometimes called bundle of His, H-I-S, and then it comes down to your Purkinje fibers that then stimulate the ventricles to contract. This is probably something you're familiar to seeing, like you see it all the time. It's an ECG or EKG, it's an electrocardiogram. The K was because the Germans got to name it first, but more accepted in the US is ECG, electrocardiogram. Looking at your ECG, on the y-axis here is voltage. On the x-axis is paper speed, so how fast it's moving. You have your P wave here. The P wave is going to be the depolarization of the atria. So that is that sinoatrial node sending its signal, right? Then you have this PR segment. So this SA, or the SA sent its signal, and you get your PR segment, which is how long it takes for that signal to reach the AV node. And then the AV node shoots off and stimulates the ventricles. So this is ventricular depolarization here at the QRS complex. And then you have your ST, which is the delay between depolarization and repolarization of the ventricles. So a lot of heart diseases can influence the electrical activity of the heart. It can also just damage the heart. So there are things that we can see. So chronic heart failure, CHF, you get decreased strength, and so the heart can't push as hard, which means that it is going to get filled up with blood. And then since there's lower blood systemically, the kidneys retain water. Because they're like, oh, we don't have enough blood. And so they retain water to hopefully get more water into your circulatory system to give you more blood. And then the heart can't pump it all out. And so it dilates again with more blood. If one side is beating more efficiently than the other side, so if your left side is beating really well but your right side isn't, you'll end up with pulmonary edema. And so the extra fluid that isn't making it back into the heart because that side's not beating so well builds up around the lungs, which then can cause congestive heart failure, where it pushes on the heart and it basically just squeezes it till it can't beat anymore. If the right side is beating better than the left side, you'll get like ascites, you'll get fluid building up around in the stomach and edema in the hands and feet at the extremities. Coronary artery disease, that's when not enough blood is going through the coronary arteries. Typically, this is due to arteriosclerosis or atherosclerosis, where you get a hardening. If it's atherosclerosis, it's these fatty plaques that build up on the inside that decrease the flow of blood to the heart. The heart really needs a lot of oxygen. It does not do anaerobic respiration very well. It builds up lactic acid really quickly, and those heart cells die really quickly. You also do not replenish heart cells very well, and so they don't heal very well. And so if they die, it's kind of game over for that area. Angina pectoralis, this is chest pain. Typically, this is due to low coronary flow. Angina pectoralis, pectoris, is a type of referred pain, and so it is the heart that's actually hurting, but it feels like it's your upper chest side, left side, maybe down, radiating down the arm. A myocardial infarction is when an area that is deprived of blood dies and starts going through necrosis. We'll pick up with our anti-arrhythmic drugs in the next section.